PGS and PGD are technologies which allow us to see inside the embryo and figure out whether or not embryos have certain genetic conditions. PGS, which is more commonly done, stands for Preimplantation Genetic Screening. This is a process where we actually count the number of chromosomes within an embryo in order to ensure that each embryo has the appropriate number of chromosomes. Chromosomes are what carry our genetic material, and it's our genetic code. It's what tells us who we are. Patients who choose to do PGS are able to increase their success rate by screening for embryos which are much more likely to implant, and they're also perhaps decreasing the risk of miscarriage as well.
PGD is a little different. PGD is Preimplantation Genetic Diagnosis, and this is used when we have a family who has a genetic disease that is propagated within that family. So if somebody is a carrier for a disease like cystic fibrosis or thalassemia or Tay-Sachs disease, those are specific gene disorders that we can then target on an embryo to see if that embryo is going to be affected with that disorder.
We started in 2016 with the process after a failed miscarriage, and having to deal with that loss and just wanting to move forward. It's a very emotional journey just because you don't know what's going to happen. You put all this energy into just trying to build a family and, create something so wonderful.
What's your message for those families who may be going through the same thing?
Never give up. It's honestly, it's cliche, but it's true. And being that we came to the Fertility Institute of Hawaii, they've become more than family. They're there to hold your hand. They walk you through every step. And as emotional as it is and trying on your body, the end result is more than anything you could ever ask for. So just keep trying.
Well, thank you so much for being here and telling and sharing your wonderful story. Of course, for more information on this and the Fertility Institute of Hawaii, just head to our website, hinowdaily.com.
This segment is sponsored by Fertility Institute of Hawaii.